Are you making sure that you're recovering enough as you prepare for this upcoming race season in South Florida? Hi, I'm Dr. Gage Winkles. I'm a sports chiropractor here at Health Fit Chiropractic and Sports Recovery right here in Boca Raton, Florida. And today we're going to go over a common case presentation that we see far too often in our endurance athletes here in South Florida, and whether it be a marathon runner, a triathlete, or even someone just training for their first 5K. So here on our smartboard, I have pulled up our human anatomy model, and we're going to zoom in on the back of this person here, right in on the hamstring muscles here. So what we see far too often is with the hamstring muscles here, a patient will come in and maybe they're a month into training for their first marathon. They're increasing mileage and things are feeling pretty good, but that right hamstring is starting to get a little bit sore. And they're noticing it, at the end of their run or following their run. They go to start that next run and they're feeling some tenderness, maybe up kind of underneath the glutes here, or maybe even back behind the knee. And they're just going to continue to kind of ignore that and just keep training through it, right? What happens if you are not prioritizing recovery during things like marathon training is that injury falls into what we call as the overuse injury cycle, where if we picture a cycle here, kind of like a clock, we start at the top where that initial presentation happens, right? You start marathon training. And as we work to the right, we'll get to maybe some pain starts to appear and it's kind of lingering, but you just ignore it. It's not hindering your performance at all. As we go from that 3 o'clock region down to 6 o'clock here, we reach a stage where now it is starting to hinder some performance. And that is typically when you present to our office where that hamstring right up underneath the glutes is becoming real tender and sore when you sit or train. Or behind the knee, you're noticing a little bit of swelling and tightness and soreness even as you're walking now, maybe not even when you're training. And that's when you present to our office. And as we transition from 6 o'clock up to 9 o'clock here, that's where we'll treat and we'll calm down that muscle. We'll do that through specific rehab exercise, maybe some shockwave therapy to reduce inflammation in the area. We'll take care of some soft tissue restrictions with active release technique. And we'll make sure joints in the hip, the pelvis, the low back, the knee are all moving properly with joint manipulation. But then what happens is after that 9 o'clock stage, we go back up to 12 o'clock here. And at 12 o'clock, we continue training, and maybe that's when our mileage increases, and we haven't changed anything with our recovery. So here we like to promote recovery, obviously with conservative chiropractic care here and specific rehab exercise. That's going to happen in office and outside the office that you can do on your own. Things like talking about nutrition, passive recovery modalities such as saunas, cold plunges, massage guns, heat, ice. We will go over all of that with you and find some tools at your disposal to help you get to the finish line and complete that upcoming race you're training for and not be hindered by any sort of injuries. If you have questions about how you can optimize your recovery during your upcoming race season here, give us a call today and we'll be happy to talk. Take care.